Good morning to all. I am Dr. Subbaiah. Today I am going to discuss 50 rapid fire respiratory case scenarios. So, what to suspect when a child presents with respiratory symptoms? Cyanosis seen only in legs and hands of a newborn baby without respiratory distress. So, clinical diagnosis is acrocyanosis. Newborn presented with drooling of saliva and respiratory distress since birth. X-ray with infant feeding tube showed coiling of the tube. Esophageal atresia with tracheoesophageal fistula suspected. A 32-week-old preterm baby presented with poor feeding, warm trunk, cool peripheries and cyanosis. Axillary temperature 34.8 degrees Celsius. The baby is in hypothermia, cold stress. The term neonate delivered by cesarean section developed respiratory distress within 2 hours of birth. X-ray showed diffuse streaky opacities, transient tachypnea of the newborn. 30-week-old preterm baby developed respiratory distress, grunting and cyanosis within 6 hours of birth. X-ray bilateral whiteout lung, respiratory distress syndrome. 38-week-old term baby with meconium stain liquor developed respiratory distress, grunting, cyanosis within 6 hours of birth. X-ray bilateral perihilar coarse reticular opacities. Diagnosis meconium aspiration syndrome. The 30-week-old preterm baby developed recurrent apnea and cyanosis. Clinical diagnosis apnea of prematurity. A 38-week-old term child admitted with respiratory distress, grunting and cyanosis, mediastinal shift to the right side, air entry decreased on left side, and X-ray showed congenital diaphragmatic hernia left side. 32-week-old baby on ventilator suddenly developed respiratory distress and cyanosis, air entry decreased on left side. X-ray showed pneumothorax left side. 1 month old baby presented with noisy breathing, weight gain was adequate, stridor present. Laryngomalacia. 3-month old well child presented with sudden onset of dyspnea and cyanosis. So suspect milk aspiration when dyspnea occurs in a well child. A 8-month-old infant came with dyspnea for 2 days. An examination, bilateral V's present, and X-ray showed bilateral hyperaeration, bronchiolitis. A 1-year-old child admitted with sudden onset of breathlessness. An examination, cyanosis present, ejection systolic murmur at pulmonary area, saturation was 65%. Chest X-ray showed boot-shaped heart. The diagnosis, tetralogy of Fallot. A 1-year-old child presented with gradual onset of dyspnea for 6 months, failure to thrive present, pansystolic murmur at left sternal border, hepatomegaly present. X-ray showed cardiomegaly with pulmonary congestion. Ventricular septal defect is the clinical diagnosis. A 1-year-old child presented with fever and respiratory distress. Heart rate was 227 per minute, and ECG showed supraventricular tachycardia. A 6-year-old child presented with breathlessness for 6 months. On examination, soft systolic murmur present and pallor was also present. Anemia, HB was 7 grams percentage. A 2-year-old healthy child admitted with sudden onset of dyspnea and cyanosis. So whenever a child presents with sudden onset of dyspnea, again the probable diagnosis is foreign body aspiration. So in this X-ray you can see the hyperlucency in the left side of the lung. 1-year-old child presented with breathlessness and altered sensorium for 1 day. And polyuria present, urine sugar and ketone present. diabetic ketoacidosis. A 3-year-old child presented with fever, respiratory distress and cyanosis. X-ray showed opacity in the right upper lobe. So consolidation right upper lobe. A 4-year-old child presented with fever, respiratory distress and cyanosis. On X-ray, you can see the cardiophrenic ostophrenic angle obliterated and a curvilinear opacity seen in the left side. The diagnosis pleural effusion. A 2-year-old child presented with fever, respiratory distress. On examination, straight line dullness was seen on percussion. X-ray showed hydropneumothorax left side. A 8-year-old boy admitted with recurrent exertional breathlessness for the past 2 years. On examination, bilateral V is present. Clinical diagnosis, hyperreactive airway disease. A 6-year-old child presented with fever, dyspnea, chest pain, trachea shifted to right side, movement decreased on left side, stony dullness on percussion on left side. X-ray, massive pleural effusion left side. A 15-year-old developmentally delayed child presented with recurrent respiratory tract infection. And X-ray showed pneumonic changes which are due to chronic recurrent aspiration. A 6-year-old child presented with dyspnea and lying down. There is 2 × 2 cm right cervical lymphadenopathy present. And X-ray showed mediastinal widening. Diagnosis lymphoma. A 8-year-old child came with dyspnea for 2 days and altered sensorium. In examination, child was short stature and anemia present. No hepatosplenomegaly. Urea creatinine elevated. It's a uremic acidosis. A 3-year-old child presented with dyspnea, drooling of saliva and a dysphagia for 1 day. This is the X-ray lateral view of the neck which showed enlarged epiglottis. So thumb sign epiglottitis is the diagnosis. A 5-year-old child came with sudden onset of dyspnea, blood pressure 150/110, cola colored urine, it's acute glomerulonephritis, left ventricular failure. A 3-year-old child presented with barking cough and stridor for 3 hours. And X-ray showed steeple sign and edematous subglottic mucosa on video endoscopy. So it's a acute laryngotracheobronchitis group. 11-year-old child presented with dyspnea for past 3 hours. Steenberg sign was present. So what is Steenberg sign? It's also known as thumb sign. So one of the clinical examination tests for Marfan disease in the hands. So it's a clinical test in which the tip of thumb is visible beyond the little finger when it is clasped in the clenched hand. So X-ray showed pneumothorax left side. So Marfan's patients are more prone to develop spontaneous pneumothorax. A 3-year-old child recurrent wheeze not responding to beta-2 agonist and inhaled corticosteroids. The bronchoscopy showed exaggerated collapse of the airways during expiration. So tracheomalacia. A 80-year-old well child presented sudden onset of dyspnea. The history of drug ingestion was present. Clinical diagnosis anaphylaxis. A 2-year-old child presented with diarrhea for the past 2 days and presented with breathlessness and altered sensorium. Oliguria present. Diagnosis severe dehydration. A newborn presented cyanosis and respiratory distress. This is the X-ray picture which showed egg-shaped heart. Clinical diagnosis TGA, transposition of great arteries. A 3-year-old child came with fever, cough, stridor and rapid onset of respiratory distress. And X-ray showed irregular soft tissue filling defects within airway. It's a bacterial tracheitis. A 2-month-old baby presented with stridor, choking that worsens with feeding, apneic attacks, noisy breathing. And X-ray impressions on the trachea from both the right and left. So diagnosis double aortic arch. The 4-year-old child presented with fever and cough for 2 weeks. So this is the X-ray chest which showed right-sided hilar adenopathy and collapse consolidation, which are characteristic features of primary tuberculosis. The 1-day-old neonate presented with severe respiratory distress and noisy breathing, inability to pass a NG tube through the each nostril into the nasopharynx. So this is the axial CT image shows bilateral bony choanal atresia. The 12-year-old child presented with chronic nasal obstruction and purulent rhinorrhea. So this is the CT image which showed unilateral right-sided bony atresia with fluid in the nasal cavity. A 6-year-old boy presented with persistent nasal discharge and cough for 12 days without any improvement. Clinical diagnosis acute bacterial sinusitis. The 4-year-old child presented with fever, irritability, decreased oral intake, drooling and a refusal to move the neck. And X-ray showed increased prevertebral soft tissues, thickening of the prevertebral soft tissues, which are characteristic features of retropharyngeal abscess. The 1-year-old child presented with recurrent respiratory tract infections. On X-ray, there is a hyperlucency in the left lung, which is a diagnosis congenital lobar emphysema left side, also known as congenital large hyperlucent lobe. The 1-year-old child presented with respiratory distress and cyanosis. So this is the X-ray picture. So it showed figure of 8 appearance or snowman appearance, which is the classical feature of TAPVC, total anomalous pulmonary venous connection. The neonate presented with respiratory distress. This is the X-ray picture which showed large multicystic mass in the left hemithorax with mediastinal shift. Diagnosis congenital pulmonary airway malformation. The 4-year-old child presented with fever and difficulty in swallowing. On the X-ray, lateral view showed marked enlargement of the adenoid tonsils due to streptococcal pharyngitis. The 2-year-old child presented with fever and dyspnea for 3 days. On X-ray, a large cavity with 2 air fluid levels in the right upper lobe is seen. It's seen in pulmonary abscess. 4-year-old child presented with the features of obstructive sleep apnea, snoring and daytime sleepiness. So this is the X-ray and MRI picture which showed the enlarged lingual tonsils. The 2-week-old baby presented with stridor. An asymmetric narrowing of the airway on X-ray was seen. So this is the endoscopic view which showed bulging red mass protruding into the subglottic trachea and narrowing of the trachea, which is a typical feature of an infantile hemangioma. The 4-year-old child with recurrent respiratory tract infections and clubbing, and X-ray and CT showed bronchiectasis. This is classically seen in cystic fibrosis. The 3-month-old boy presented with respiratory distress and cyanosis and massive cardiomegaly with a decreased pulmonary vascularity, the box-shaped heart, which is classically seen in Epstein's anomaly. A 10-year-old boy presented with dyspnea and stabbing chest pain that radiates to the neck after chest injury. So this is the X-ray picture which showed spinnaker sail sign. Air deviates the thymus upward and outward. This is classically seen in pneumomediastinum. So these are the references. Thank you.